He went to bed like every other night. The house was quiet. The lights were off. Everyone believed he was resting peacefully. But the warning had been there for months. Not in his chest during the day. Not in his medicine cabinet. Not in a hospital report. The warning was in the sound of his sleep, loud snoring, sudden silence, then a gasp, then sleep again. And everyone said the same thing. He always sleeps like that. But what if that was the mistake? What if the sound everyone laughed about was not harmless snoring? What if the silence after the snore was the real warning? What if the danger was not outside the house, but happening inside his own airway while everyone thought he was safe? And what if the heart was being forced into emergency mode again and again, night after night? I'm Dr. Alan Mandell, and today I want you to stop ignoring one nighttime pattern that can place serious stress on the heart, brain, blood pressure, and oxygen levels after 60. Now listen carefully. This does not mean every person who snores is in danger. It does not mean you should panic tonight. But if you or someone you love snores loudly, stops breathing, wakes up gasping, sleeps flat on the back while struggling to breathe, or wakes up exhausted after a full night in bed, this video may be one of the most important health warnings you hear this year. Because the danger is not one bad night. The danger is the pattern nobody talks about. And once you understand what happens inside the body, you may never hear loud snoring the same way again. Before I show you the 7 warning signs, you need to understand why this becomes more serious after 60. Now, before we go any further, I want to make something very clear. Sleep is not the enemy. Sleeping on your back is not dangerous for every person. And snoring one time after a long, tiring day does not automatically mean something terrible is happening. But there is a very big difference between normal sleep sounds and a repeated breathing pattern that your body is struggling to survive. That is the difference most people miss. They think snoring means deep sleep. They think gasping means the person had a bad dream. They think waking up tired is just part of getting older. But sometimes the real problem is not how long you slept. The real problem is how many times your breathing was interrupted while you were sleeping. Because your body does not only need sleep, your body needs oxygen while you sleep. Your heart needs oxygen. Your brain needs oxygen. Your blood vessels need oxygen. And when breathing keeps stopping, narrowing, choking, or restarting again and again, the body may enter a stress state during the exact hours it is supposed to be repairing itself. The mistake is not sleeping. The mistake is calling a breathing struggle normal because it happens every night. In medicine, we do not only ask how many hours you were in bed, we ask what your body was doing during those hours. Were you breathing smoothly? Were you waking up gasping? Was your oxygen dropping? Was your heart racing? Was your blood pressure rising while everyone else thought you were resting? That is the hidden danger. The danger is not sleep. The danger is what happens when your breathing keeps stopping during sleep. And this is why I do not want you to laugh off loud snoring, choking sounds, morning headaches, dry mouth, or daytime exhaustion after 60. Because the heart does not get to rest when the body keeps waking up for air. Now let me explain why this becomes more serious after 60. When you are younger, your body often has more reserve. Your heart can tolerate stress more easily. Your blood vessels may respond faster. Your oxygen levels may recover quickly after a brief disturbance. But after 60, the body does not always bounce back the same way. After 60, the body has less margin for repeated emergencies. Many seniors are already dealing with high blood pressure, diabetes, weight gain around the neck or abdomen, heart rhythm problems, inflammation, medications, or reduced muscle tone in the airway. So when breathing keeps stopping or becoming blocked during sleep, it is not happening in a perfectly young, untouched body. It is happening in a body that may already be working harder during the day. And then, instead of resting at night, the body is forced to fight again. That is the part I want you to understand. One bad night is usually not the story. The repeated pattern is the story. Night after night, the airway narrows. Night after night, oxygen may drop. Night after night, the brain has to send emergency signals to wake the body just enough to breathe again. And every time that happens, the heart can be startled, blood pressure can surge, stress hormones can rise, sleep becomes broken, even if the person does not remember waking up. This is why some people sleep for 7 or 8 hours and still wake up exhausted. They were in bed, but their body was not truly resting. This is also why I never ignore sleep complaints in older adults, especially when the family says, "Doctor, he snores so loudly we can hear him through the wall," or "She suddenly stops breathing, then gasps." That is not something to laugh off. That is a pattern to pay attention to, because after 60, your body may not recover from oxygen stress the way it did when you were younger. And now, let me show you the mistake that makes this worse for many seniors. The mistake is not simply lying down. The mistake is lying flat every night while your body is already showing signs that it cannot breathe properly. Now listen carefully, because I do not want you to misunderstand this. Sleeping on your back is not dangerous for every person. Some people sleep on their back their whole life and breathe normally. But for many people who already snore loudly, gasp, choke, or have breathing pauses during sleep, lying flat on the back can make the airway struggle even more. Here is why. When you lie flat, gravity can pull the tongue and soft tissues backward. In some people, especially after 60, those tissues can narrow the airway. The air has less room to move. The throat vibrates. Snoring becomes louder. Then, in more serious cases, the airway may partly or fully block for a few seconds. That is when the body starts fighting. The oxygen can drop. The brain senses danger. The heart gets startled, and the person may suddenly gasp, choke, snort, or briefly wake up without even remembering it in the morning. This is why your sleeping position matters more when warning signs are already present. If you snore louder on your back, pay attention. If your spouse says you stop breathing, do not laugh it off. If you wake up choking, that is not normal, peaceful sleep. When patients tell me they wake up gasping, I do not ask only about their pillow. I ask about their airway, their oxygen, their blood pressure, and their heart. Because the pillow is not always the problem. The mattress is not always the problem. The real problem may be that the airway is collapsing when the body should be resting. So tonight, do not panic, but do observe. Ask yourself, do I snore more on my back? Do I wake up with a dry mouth? Has anyone told me I stop breathing? Do I wake up tired even after a full night in bed? Those questions matter, because this is where the heart attack and stroke connection begins. And once you understand what happens inside the body, you will never hear loud snoring the same way again. Now let me take you inside the body for a moment, because from the outside, the person may look like they are sleeping. Their eyes are closed, the room is dark, the house is quiet. But inside the body, something very different may be happening. When the airway narrows or closes during sleep, air cannot move properly into the lungs. Oxygen begins to drop. The brain senses that something is wrong. And because the brain's first job is survival, it sends an emergency signal. Wake up enough to breathe. Not fully awake. Not always enough to remember it. But enough for the body to gasp, snort, choke, or shift position just to open the airway again. Then the person falls back into sleep. But a few minutes later, it may happen again, and again, and again. This is why this pattern can be so dangerous after 60. Your heart is supposed to rest at night. Your blood pressure is supposed to settle. Your brain is supposed to repair. Your body is supposed to recover from the day. But when breathing keeps stopping, the heart is forced into emergency mode again and again. The stress response turns on. The heart rate can jump. Blood pressure can surge. The body releases stress hormones. The blood vessels tighten. The brain receives less steady oxygen, and over time, this repeated nighttime stress can place pressure on the same systems that are connected to heart attacks, strokes, rhythm problems, and uncontrolled blood pressure. This is the part most people never see because it happens in the dark. A wife may hear the snoring. A husband may hear the choking. A family member may notice the silence. But the person sleeping often says, "I'm fine. I don't remember anything." Of course they do not remember. The body may be waking them for only seconds at a time. But the heart remembers. The blood pressure remembers. The brain remembers. That is why you should never judge sleep only by the number of hours in bed. Someone can spend 8 hours in bed and still have a body that is fighting all night. This is why morning tiredness, headaches, dry mouth, and daytime sleepiness matter. They may be the clues left behind by a night your body never truly survived peacefully. Now stay with me, because these 7 signs are not equal. The first one is common, the second one is frightening, but the fourth one is where the heart and stroke risk becomes impossible to ignore. Let's talk about the 7 warning signs most families miss before something serious happens. Warning sign number 1 is loud snoring that gets worse when you sleep on your back. Now, not every snore is dangerous. Some people snore lightly when they are tired, congested, or sleeping in a certain position. But there is a difference between soft snoring and the kind of snoring that sounds like the body is struggling to pull air through a narrow space. That kind of snoring should not be ignored after 60, especially if it becomes louder when you lie flat on your back. Because when you sleep on your back, the tongue and soft tissues of the throat can fall backward. In some people, this makes the airway narrower. The air has to squeeze through. The throat vibrates harder. The sound gets louder. And that loud sound may be your first clue that breathing is not smooth. I have seen many families laugh about this. They say, "Doctor, he snores so loud the whole house can hear him." But I do not laugh first. I ask one question. Does the snoring stay steady, or does it stop and restart? Because steady noise is one thing. Noise followed by silence is something else. So if you or someone you love snores loudly after 60, especially while sleeping flat on the back, pay attention. The person sleeping beside you may know more than you do, but snoring is only the sound. The next warning sign is the silence after the sound. Warning sign number 2 is the one spouses remember because it turns the bedroom silent. Breathing pauses. This is when the snoring suddenly stops, and for a few seconds, the room becomes quiet. Not peaceful quiet, a dangerous quiet. The person looks asleep, but the chest may not be moving normally. The breathing seems to pause. The spouse watches. The family member waits. 3 seconds, 5 seconds, sometimes longer. Then suddenly, a gasp, a choke, a loud snort, a desperate breath, and then the person goes right back to sleep as if nothing happened. But something did happen. That gasp was not normal rest. It was the body pulling itself out of danger just enough to breathe again. And here is what makes this so serious. The person who is having these pauses often does not remember them. They may wake up in the morning and say, "I slept fine." But the person beside them may have spent the night listening to the silence, waiting for the next breath. When a family member tells me, "Doctor, I watched him stop breathing," I take that seriously every single time, because loud snoring can be a clue. But pauses in breathing are a stronger warning. If someone has told you that you stop breathing during sleep, do not argue with them. Do not laugh it off. Do not say, "That is just how I sleep." You cannot watch yourself sleep. So sometimes the person who loves you sees the danger before you do. And even if nobody sees the pauses, your morning body may still reveal what happened overnight. Warning sign number 3 shows up in the morning. And this is why so many people miss it. They do not connect the morning problem to the nighttime breathing. They wake up with a dry mouth and think, "Maybe I need more water." They wake up with a headache and think, "Maybe I slept wrong." They wake up tired after 7 or 8 hours in bed and think, "Maybe I am just getting older." But after 60, I want you to pay closer attention to that pattern. If you slept all night but wake up feeling like you never truly rested, your body may be telling you something important. The clock says you slept, but your brain says you did not. Your mouth is dry. Your head feels heavy. Your energy is gone before the day even begins. And sometimes the reason is that your breathing was interrupted again and again while you were asleep. When breathing becomes difficult at night, many people breathe through the mouth. That can leave the mouth dry in the morning. When oxygen is not steady, some people wake with headaches. When sleep is repeatedly broken, even for seconds at a time, the body may never reach the deep restorative rest it needs. Dr. Alan Mandell often explains health in a simple way. Do not only look at the symptom, look at the pattern behind the symptom. And the pattern here is important. Morning headache plus dry mouth plus daytime tiredness should not be ignored, especially if loud snoring, choking, or breathing pauses are also present. because the next warning sign is the one that connects directly to heart attacks and strokes. Warning sign number 4 is high blood pressure that seems hard to control, and this is where the heart attack and stroke connection becomes much more serious. Many people think high blood pressure is only about salt, stress, weight, or medication. And yes, those things matter. But sometimes there is another hidden piece of the puzzle: your sleep. If the medicine is working during the day, but your pressure is rising at night, the missing clue may be your breathing. Because if your breathing keeps stopping during the night, your body may be forced into a stress response over and over again. Oxygen drops, the brain reacts, the heart gets startled, blood vessels tighten, stress hormones rise, and blood pressure can surge during the exact hours when it should be calming down. That means the body is not getting a peaceful night, it is getting repeated emergencies. Dr. Alan Mandell has always taught that you must look for the root cause, not just chase the symptom. And when someone after 60 has loud snoring, morning headaches, daytime tiredness, and blood pressure that stays high even with medication, nighttime breathing should be part of the conversation. Now listen carefully. This does not mean you should stop your blood pressure medicine. Never stop medication without speaking to your doctor, but it does mean you should ask a better question. What is happening to my breathing while I sleep? Because the problem may not only be salt, it may not only be stress, it may not only be age, it may be what your oxygen, airway, and heart are doing at 2 o'clock in the morning while everyone thinks you are resting. And when blood pressure rises again and again at night, the brain and heart are not protected. If this sounds like someone in your home, do not ignore it. Write the word sleep in the comments, because sometimes the first step is simply admitting that the pattern is there. Warning sign number 5 is waking up suddenly gasping, choking, or feeling your heart racing. This is one of the signs people often explain away. They say, maybe I had a bad dream. They say, maybe it was anxiety. They say, maybe I ate too late. And sometimes those things can play a role. But if you are over 60 and this keeps happening, especially with loud snoring or breathing pauses, you should not ignore it. Because waking up gasping is not normal, peaceful sleep. It may be your body pulling you out of a breathing struggle. Think about what is happening. Your airway narrows, your oxygen drops, your brain senses danger. Then suddenly, your body jolts you awake just enough to breathe again. That sudden gasp has a reason. That racing heart has a reason. That choking feeling has a reason. Dr. Alan Mandell often reminds people that the body gives warning signs before it gives emergencies, and this is one of those signs that deserves attention. Do not simply buy a new pillow and forget about it. Do not just raise the head of the bed and assume the problem is solved. Do not keep telling yourself it only happens sometimes if it is becoming a pattern. Tonight, if you wake up gasping, choking, or with your heart pounding, write it down. What time did it happen? Were you on your back? Was your mouth dry? Did you feel short of breath? Then bring those details to your doctor, because one ignored night can become a repeated pattern, and one repeated pattern can place pressure on the heart, brain, and blood vessels over time. But one of the most ignored signs appears during the day, not at night. Warning sign number 6 appears during the day. Daytime sleepiness, brain fog, low energy, falling asleep in the chair, napping again and again, even after spending 7 or 8 hours in bed. Now, many seniors blame this on age. They say, I am just getting older. They say, I do not have the same energy anymore. They say, everyone slows down after 60. And yes, energy can change with age, but constant daytime exhaustion is not something you should ignore, especially if the night before was filled with loud snoring, gasping, choking, or restless sleep, because your body may be trying to recover from a night it never truly slept through. You were in bed, your eyes were closed, but your breathing kept interrupting the repair process. Deep sleep is when the body restores energy, repairs tissue, balances hormones, supports memory, and calms the nervous system. But if the brain has to keep waking the body just to breathe, that deep repair may be broken again and again. Dr. Alan Mandell often teaches that fatigue is not always laziness. Sometimes fatigue is information. So if you are falling asleep during the day, feeling foggy, forgetting simple things, or needing long naps just to function, do not blame age too quickly. Your sleep may be giving you quantity without quality. And now here is the warning sign families often dismiss until something serious happens. Warning sign number 7 is when your family notices something you cannot see yourself. This may be the most important sign of all, because you cannot watch yourself sleep. You may wake up in the morning and believe everything was normal. You may say, "I slept fine." You may not remember gasping, choking, moving, or briefly waking up, but the person beside you may have watched the whole thing happen. Your spouse may say, "You stopped breathing." Your daughter may say, "I heard you choking in your sleep." Your son may say, "You snore so loudly, then everything goes quiet." Your family may notice that you wake up more tired, more irritable, more forgetful, or more short of breath than before. Do not dismiss them. The person beside you may be your first warning system. Sometimes the person who loves you sees the danger before you do. Dr. Mandell often reminds people that the body whispers before it screams. But sometimes that whisper is heard by someone else first. So if your family tells you something is wrong with your sleep, listen. Do not call them dramatic. Do not call it normal. Do not say, "That is just how I sleep." Because if loud snoring, gasping, pauses, morning headaches, daytime sleepiness, and high blood pressure are showing up together, it is time to take the pattern seriously. So what should you actually do tonight? First, do not panic. But also do not ignore the pattern. Tonight, you do not need fear. You need a simple observation plan. If you or someone you love is snoring loudly, gasping, choking, stopping breathing, waking up with headaches, feeling exhausted during the day, or struggling with high blood pressure, this is not something to simply laugh off. The first step is awareness. Ask the person who sleeps near you what they notice. Do you snore louder on your back? Do you stop breathing and then gasp? Do you wake up choking? Do you move restlessly all night? Do you seem tired even after a full night in bed? Write these things down, because when you go to your doctor, details matter. Do not just say, "I snore." Say, "My family says I stop breathing." Say, "I wake up gasping." Say, "I wake with a dry mouth and headache." Say, "My blood pressure is hard to control, and I feel exhausted during the day." Those details can help your doctor decide whether you need a sleep evaluation or a sleep study. Dr. Mandell often teaches that the body gives clues, but you must collect them before you can understand them. Tonight, if sleeping flat on your back makes your snoring worse, try sleeping on your side. Do not use alcohol as a sleep aid. Do not take extra sleeping pills or sedatives unless your doctor has specifically told you to, because some substances can relax the airway and make breathing problems worse. Keep your bedroom comfortable. Elevate your head slightly if that helps you breathe easier. Track your symptoms for a few nights. And most importantly, talk to a qualified healthcare professional. This video is not telling you to diagnose yourself. It is telling you not to ignore warning signs. And if you ever have chest pain, severe shortness of breath, weakness on one side of the body, facial drooping, confusion, or trouble speaking, do not wait. Get emergency help immediately, because tonight, the goal is simple. Do not fear sleep. Respect what your breathing is telling you during sleep. The goal is not to scare you out of sleep. The goal is to help you sleep in a way that lets your heart and brain finally rest. And now I want to bring this back to the real reason this matters: your independence. This is not only about snoring. This is not only about sleeping on your back. This is not only about waking up tired. This is about protecting the heart that carries you through every day. It is about protecting the brain that holds your memories, your family, your prayers, your stories, and your independence. Because after 60, independence is precious. Walking into your own kitchen, driving yourself to the store, playing with your grandchildren, remembering names, getting up in the morning with energy, living in your own home with confidence. These things are not small, and that is why nighttime breathing should never be ignored. Do not let pride keep you silent. Do not call it normal just because it happens every night. Do not laugh when someone says, "You stopped breathing in your sleep." The warning may be happening while the whole house is asleep. Dr. Alan Mandell always reminds people that the body is designed to heal, but first, you must listen to what it is telling you. So tonight, listen. If you snore loudly, wake up gasping, feel exhausted in the morning, struggle with high blood pressure, or someone says you stop breathing during sleep, speak with your doctor. Do not diagnose yourself. Do not panic, but do not ignore it, because the danger is not one bad night. The danger is the pattern nobody talks about, and the warning that happens at night can change the life you live in the morning. Comment below. Are you over 60? And has anyone ever told you that you snore, gasp, or stop breathing during sleep? Share this with someone you love. Until next time, sleep wisely, breathe deeply, and protect your health before the warning becomes an emergency.